It's said that more law enforcement officers die by suicide than in the line of duty, especially around the holidays. Nationally, this rate has increased over the past couple of years, but Millcreek Township's police department is pushing back against that trend, helping their officers. Jade Leah Burns joins us now in our studio with much more about a new program. Jade.
Sean, according to the Substance Abuse and Mental Health Service Administration, it's estimated that 30% of first responders develop behavioral health conditions. One department is trying to get rid of the stigma around this topic. Millcreek Township began a new peer support program with their police department last spring. It's a partnership with Safe Harbor to support officers who might be going through mental health crisis, as well as supplying a co-responder to assist with calls.
There was some grant money that became available, so we applied for assistance and we were granted a 2-year grant from the PCCD.
The chief explains that officers can be exposed to traumatic events every day, such as deaths and assaults.
I think that's why across the whole profession of policing, we are seeing so many suicides. We do see more suicides at times during the holidays, probably for a variety of reasons.
A few officers went through specialized training that allows them to support their peers. Usually it can be easier for officers to go to their colleagues because many go through similar experiences.
Sometimes all it takes is just reaching out and having a short conversation with someone, just letting them know that someone cares and that someone is there to listen, and that can be all someone needs to feel better and kind of get through another day and keep pushing forward in life.
Crisis clinician Evan Daly says it's key to be able to recognize changes in our loved ones, like their acts of daily living, and be able to follow up with them.
If you give people the resources and you just kind of expect them to do it on their own, sometimes people might find that difficult. And it's important to be able to follow up with them and help them along that path if they need it.
All three agree that this program benefits their officers, and they encourage other departments to implement these resources as well.
Well, we're still humans, and unfortunately there's a stigma that we are brave and courageous, and perhaps that's why too many of us aren't seeking help when we need it, when we need to talk to somebody about some of the things we might have seen or had to be involved with.
If you recognize someone is going through a crisis, it's always recommended to get in contact with the police or a mental health service. Sean.